Although Gauteng's worst COVID-19 infections and deaths occurred in June and July, according to the latest statistical predictions, the province is yet to reach its peak. In a media briefing yesterday, the Gauteng Command Council said the province was ready to relax lockdown regulations, though. Professor Bruce Mellado, who's senior researcher at the iThemba lab at the National Research Foundation, says although the data seems to suggest Gauteng is ready for easing, any moves must be gradually phased in. As you can see, the Prof is standing by. Let's bring in him as he joins us via our video link this morning. Professor Mellado, thanks for your time and welcome to the AM report. So let's touch on some of those issues that have already been highlighted in that introduction. There's already a talk of the country easing lockdown regulations, but specifically in Gauteng, is this the best thing to do considering the province is yet to approach its peak?
Thanks for having me. That's certainly a very good question, and we are engaging with the public and other stakeholders to basically help clarify the situation. So it's very important to establish a difference or a differentiation between a surge and controlling a surge and the peak of a pandemic. Not every situation whereby you have an increase and a drop is the peak of the pandemic. What's happened in Gauteng and most likely elsewhere in the country is that the first large surge in the number of cases that are mostly driven, at least in Gauteng, by hotspots have been put under control thanks to the combined action of proactive measures by departments of health, stakeholders, and the population, improving adherence to social distancing. This doesn't imply that we have reached the peak of the pandemic. And that has to do with the fact that there's still a lot of people, the majority of the population is still susceptible, and that population can contract the virus if we relax social distancing or non-pharmaceutical interventions too quickly and too suddenly.
That's very interesting. So how do you distinguish then between a surge and a peak? I mean, I imagine the empirical data is that you'll see infections rising, but then how do you ascertain that this is because we're approaching a peak versus us experiencing any other surge?
That's a very good question, and the answer to it goes through the deep analysis of the data. And that's why you need a team of experts that is composed of clinicians, practitioners, epidemiologists, but also physicists, mathematicians, and data scientists that go deep into the data to understand its trend. So when if you remember, the numbers in the Gauteng province started to rise significantly towards the end of May, departing from a smoother kind of behavior. Then it became quite steeper in June, and then slowed down in July. Now, what you do is to basically look deeper into the characteristics of that data, in particular, how that data is grouped geospatially. And what you basically do with artificial intelligence is try to separate hotspots from this overall average dynamic of the province, which is really the one that is going to be driving the pandemic, that does drive the pandemic, that creates the hotspots, and that will eventually give you a massive peak if it is not put under control. So once you look at those, that wealth of data and wealth of information, you realize already we realized in June that the peak, not the peak, the surge was going to slow down and turn over. Why? Because it was dominated by hotspots as opposed to a massive, so to say, uncontrollable spread. So back then, we basically already predicted back in June that the surge was going to be put under control because hotspots were in fact acted upon by different stakeholders in order to be stopped, and it so happened. Now, this is, of course, not something that we can take for granted. It is the result of a lot of work, and also it's the result of the fact that the population took the pandemic very, very seriously and engaged very seriously in social distancing, which basically speaks to the fact that South Africa and South Africans are in a great position to work with stakeholders in order to stop the pandemic and slowing down the pandemic.
And that's where I was going to take the conversation, but my question is already answered. So let me ask rather about the hotspot areas. I remember 2 weeks ago, it must have been, Premier David Makhura mentioning that areas like Soweto were a big area of concern. I wonder whether the modeling has shifted the dial, so to speak, and given us new areas that we need to be worried about.
Right, that's certainly a very good question, because that speaks to the gist of the complexity of hotspots and how complicated they are. Now, what we do is we basically monitor carefully on a daily basis the creation of hotspots, the creation of clusters of people that are positive. And what happens with hotspots is that we can't predict where they will emerge. It's something that nobody can do, because it is a spurious process. What we can do is to say, well, we see a hotspot being created, and based on the general characteristics of hotspots in the province, we can make a projection as to when that hotspot will reach a maximum and then drop, and then we can monitor to basically ascertain that that hotspot is being put under control. We also classify hotspots. There are hotspots that are more dangerous than others. Hotspots that are very dangerous are those that grow very rapidly. That means they are not basically put under control. They can actually expand in size and then swallow others, and then become basically a serious problem that can be controlled with action of various stakeholders or the population. So what basically we basically do is we monitor carefully, but we cannot say when and where new hotspots are going to appear.
Interesting. It certainly makes our response quite complex, as you rightly say. But as always with modeling, there are scenarios to be painted. I'm interested in what the scenarios are suggesting about when this peak will come in Gauteng. I think for many South Africans, the distinction between a surge and a peak has been made for the first time. And so with this understanding then, can we speak a bit more widely about when this peak is likely to come in this province?
Okay, so again, modeling is something that has to be taken with a grain of salt. Why? Because modeling is not a crystal ball. We can't predict social behavior. Okay, social behavior is a leading driver of the dynamic of the pandemic. So we can only make certain assumptions as to how the society is behaving, what is the level of adherence of the population to social distancing, and based on that, based on the data itself that is telling us about that adherence, we can make conclusion as to what's going to happen with the pandemic. Okay, so essentially what we do is we've measured the adherence of social distancing, adherence of the population to social distancing, with July data, and based on that, should that adherence basically remain, what we basically predict is that the peak would be pushed back somewhere between, say, November, January, something along those lines. But again, this implies that social behavior does not degrade, that we keep adhering to social distancing as we have been adhering in July.
Interesting indeed. Help us contextualize the epidemic, so to speak, then, in South Africa versus what's happening globally with the time we have remaining. We're already seeing other nations in the global north, in Europe, etc., scaling back on the move that we're planning to implement, as irony would have it. Is that not enough, perhaps, to have us think twice about how we'd like to approach COVID-19?
Look, we monitor what's going on around the world very, very closely. We do have a website that basically speaks to that, and we continuously analyze the data from all over the world. Now, whatever we do in South Africa has to be based on South African parameters and the study of the South African evolution of the pandemic, because South Africa has certain characteristics that make it different from European countries or the United States or any other country. In particular, Gauteng is an area of concern because we have a lot of population and areas where population is highly concentrated, and because of the way people live, unfortunately, they cannot practice social distancing. So we clearly can't basically take the parameters from Spain or Italy and apply them to South Africa. However, it's very important to study what's going on abroad, because that helps us validate the mathematics, that helps us validate the models that we use in South Africa with South African parameters in order to ascertain the most important drivers for a pandemic. And one of the reasons why we make this very clear distinction between a surge and a pandemic has to do a lot with the fact that we have seen the resurgence and the relapsing of the pandemic in many countries that were overly, so to say, optimistic in reopening the country too fast, and they have seen a resurgence in the number of cases as a result, which many people and epidemiologists and so on had, of course, caution against. So that is extremely important to have in mind. The virus in the province, and if we talk about the Gauteng province itself, is basically transmissions happen pretty much everywhere in the province. Sorry, my cat is giving me a hard time. And sorry, it's very hard to control. She doesn't speak English. And basically what happens is that, yes, the pandemic has slowed down. There's no question about it. Yeah. And there is clear empirical evidence to that effect. However, one has to take into account that because of the surge, now transmissions happen pretty much everywhere geographically. So that basically implies that the fundamentals for a second surge, or the fundamentals for the pandemic to continue and progressing towards a peak are there. Now, the good news is that given the elevated or the improved adherence of the population to social distancing, we seem to be able to, so to say, flatten that curve, to basically turn that peak more from, a spike that would have traumatic consequences to something like a hill, something basically smoother, so that the healthcare system does not get overwhelmed, that we don't have the necessary fatality.
Makes absolute sense. Thanks very much for giving us your time. We'll also give you an opportunity to prepare that breakfast for your cat. I imagine that's the reason behind that. Thanks very much indeed for coming out to the AM Report. Professor Bruce Mellado is part of Gauteng's COVID-19 Advisory Council Committee. Thanks very much indeed.